Good morning and welcome to Exceptional Women. This is Magic 106.7's Candy O'Terry. Our goal every Sunday morning is to introduce you to a woman whose life story will inspire you. And I'm pretty sure today's guest will do just that. She's the chief of endocrinology at Brigham and Women's Faulkner Hospital, the co-director of the BWH Center for Weight Management and Metabolic Surgery, medical director, Program for Weight Management, and the chair for the Symposium on Obesity and Sex Differences at the Brigham Research Institute. What a long list. Originally from Argentina, she is a graduate of both Harvard University and Harvard Medical School. And the focus of her clinical practice and her research is the connection between weight and diabetes and how lifestyle affects our health. Please welcome Dr. Florencia Halperin to the show. Thank you so much for being here.
Thank you.
So tell me when your interest in science, in biology, in research started. Were you always into that kind of thing from a very young age?
Well, my grandfather was a physician, and my father is a physician, and my mother is a psychologist. So I did grow up with a lot of stories about people, about patients, and I was from a very early age, I think, very interested in research. When I was really young, my mother tells me I wanted to be a writer, and for some time I wanted to be a chef, and these are still things I like to do on the side. But in high school, I really got interested in my high school biology class. I remember dissecting the frog and thinking the heart was the coolest thing ever. And I was really interested in working with people, and I knew that I wanted to do something that combined my interest in people and in people's stories and also in science and biology. And since I had examples in medicine, I thought that this was the right thing for me.
Boy, talk about examples in medicine. It seems like everybody had a doctor before their name in your house, right?
That's right. That's right.
So you grew up in Buenos Aires, Argentina. Please tell us what that was like.
My story is a little bit complicated. I was born in Argentina, in Buenos Aires, to my parents. And when I was almost 2, we left Argentina at a bad political time for the country. And we moved to Venezuela because my father had some relatives there. And so I was actually in Venezuela until I was 9 when we moved to Boston for my dad's job. Actually, we moved here for my dad's sabbatical. So we were planning only to be here for a year. And things went well and we ended up staying. But Argentina is a wonderful country. There's a lot of focus on family. It's a great place for children to grow up. And I've been really lucky that we've maintained a very close relationship with my family in Argentina. So I go every year back to visit. And I still use my Spanish every day with my patients. And I have 2 little children, and we are a Spanish-speaking household, so they can learn to speak Spanish.
So I'm thinking that at the age of 9, you must have gotten off of an airplane in Boston. Do you still remember that?
I really do. It was an incredible experience. I mean, moving to the United States of America, I remember that my expectations, I had heard that there were after-school programs like gymnastics. So I was like so excited to be a gymnast in the United States of America. And I remember the first day of school, I did take a few English lessons before I left Venezuela, but I really did not speak any English. And I went into the Brookline school system, and it's an immersion system. So you go into the regular classroom, and I didn't understand anything, but I had this amazing teacher, Mrs. Smith, and she pulled down a map and she showed everybody where I was from. And so although I didn't understand anything, I knew that she was pointing to my country and that I was being welcomed. But it was quite a long time until I really had friends because I didn't speak English. By Halloween, I was invited to go to someone's house to experience my first Halloween, and I was already able to communicate a little bit with those friends.
You sure were a long way from home. For those of you who are just joining us, welcome to the show. This is Exceptional Women on Magic 106.7. I'm your host, Candy O'Terry, and in the spotlight, you're hearing the story of a woman who's working really hard in Boston to do what she can in the fight against obesity and in learning more about diabetes. Her name is Dr. Florencia Halperin, and she's the chief of endocrinology at Brigham and Women's Faulkner Hospital. She's devoted her practice and her clinical research to obesity, diabetes, and their unique connection with lifestyles, especially for minorities. Let's talk a little bit about that for just a second. What is the connection between obesity and diabetes?
Well, great question. And we've learned a lot of things through research, and there's still a lot that we need to figure out. So it's one of the great medical problems of this time that the general population carries so much excess weight. And it's a very complex problem how we got to be this way. Genes have something to do with it, but the environment and how much there is availability of food and food in very concentrated in calories is very different from the way things were centuries ago. So the population is getting heavier, and that extra weight, the extra fat tissue, brings a lot of complications. And one of those complications is that it makes us resistant to insulin. Insulin is a very important hormone made by the pancreas, which lowers blood sugar. It gets blood sugar into cells where it's very important fuel for cells to do their work. So carrying extra fat tissue makes us insulin resistant. When insulin doesn't work as well, then our blood sugars get high. I'm obviously oversimplifying a very complicated issue, but we know that weight is a very significant risk factor for diabetes. It isn't the only thing, though, because there are thin people who get diabetes. And as many people know, there are two types of diabetes, type 1 and type 2. Type 2 diabetes is the one that's most related to excess weight and is the one that is the focus of my research. So as the population is getting heavier, we're seeing higher and higher rates of diabetes and of pre-diabetes, people who are very high risk for developing diabetes.
So after we listened to Dr. Halperin talk to us about this, we realized that all of us should have sat next to you in biology class. That's the first thing we realized. So let's talk about your experience at Harvard. You really excelled there. You won the Academic Achievement Award, the best thesis in biological anthropology. It seems like it was really a place for you to flourish.
Well, I did have a great experience, and I feel extremely lucky to have been able to study there. I majored in biological anthropology, which was a little bit off the beaten track for a pre-med student, but I really loved it. It's about evolution. It's about understanding why we are the way that we are. And so I wanted to understand more about hormones and in particular, how it is that the body understands for reproduction, whether there's a lot of food in the environment and it's a good time to have a baby or a time of scarcity, and how the body understands that and can sort of shut down the mechanism of reproduction. So that was the focus of my studies at Harvard and has really kind of translated very well and was an incredible experience for my future in endocrinology.
And then there was medical school. I have spoken to so many doctors who have sat right where you are, and they say that was the hardest 4 years of their life. Tell us what it was like for you.
I do agree it was very hard. After college, I had spent some time in New York, and I decided to come back home because I knew that I would need the support of my family. You spend a lot of hours studying, you spend a lot of hours by yourself, and then in the last years is when you really become introduced to medicine, to being in the hospital, to speaking with patients, to touching patients. I remember the first interview that I did with a patient and all the questions that I had to memorize to, ask in the exact right way. And it just felt so completely overwhelming. And now it's just such a natural part of my everyday job. But all along, you have the incredible sense that it's such a privilege to be able to ask these questions of these people and that they open up their stories to you. Sometimes in incredibly vulnerable situations of being sick or being with a loved one who's sick. So I do remember working extremely hard and taking it extremely seriously, but always trying to have a sense of humor and being sort of a human, a warm heart, a warm hand for the person on the other side on the bed.
I am always intrigued by the Hippocratic Oath because I've read it a couple of times, and I can only imagine what it must feel like when you're graduating from medical school and you're making a promise not to do further harm and to protect someone and to take care of them. What does that feel like?
Well, first, I'm so impressed that you've read the Hippocratic Oath. That's wonderful. It is really, truly an incredible and kind of indescribable experience. I mean, it is such a privilege and such an honor and such a sense of responsibility. And you just know that you have to do your best at all times and that you have to maintain a perspective about what your role there is and that you need to be very knowledgeable so that you can offer this person the best possible, medical treatment, the most up-to-date science, and that at the same time, you have to be a hand for them to hold, a shoulder for them to cry on, whatever it is that they need at that time so that they can kind of process the emotional parts of the illness as well as get the best possible treatments.
Tell me a little bit about what your vibe is with your own patients, because you're a very warm person to be in the room with. So tell me what your bedside manner is like.
I do think I probably err on the warm side. You have to be careful. I do believe you have to tell people the truth, and sometimes the truth is hard and there are hard choices to make. So, sometimes we have to be serious. But a lot of what I do, and probably my personality has shaped the choices that I've made in diabetes, in taking care of patients who have diabetes, of people who carry excess weight. We have to help them be motivated and be connected with us. And we know that engaging with a medical provider helps people make lifestyle changes. So I do try very much to engage with my patients so that they feel that I'm part of their team and we have joint goals. And I think that probably does describe my bedside manner.
What is your advice for anyone listening to this program when it comes to their weight and their good health? This is a chance for everybody to sort of get some free advice from one of the smartest docs around. What do you say?
Well, that's a very good question. I guess the first thing to understand is that carrying excess weight really is